Kalangala, Chotara, Padir, Kabarore, Gulu, Mbara and Kampala still top on the UNAIDS list of highly at-risk districts, with Kalangala at 18.2% and Chotara at 11.1% HIV/AIDS prevalence in Uganda. The Executive Director of the Infectious Diseases Institute of Makerere University, Dr. Andrew Kambugu, says that it is shocking to note that over 20% of the HIV-positive population between 15 to 49 years in Uganda does not know their zero status.
As HIV/AIDS pandemic eradication advances to the 2030 UNAIDS target, there are a great roadblocks to treatment and support, leaving many adolescent girls and youth at risk of raising infection. With young people accounting for more than 27% of new HIV infections, HIV/AIDS service organizations under the community-led monitoring are calling upon government to scale up healthcare service delivery and reduce stigma among the infected.
There's a lot of human rights violations that recipients of care report, and that affects access and utilization to services. So our call to action is that we need to listen more to the voices of the communities, the voices of the recipients of care, but also make sure that we address those gaps that they raise. That, for example, if a person comes to a facility, they should be listened to. They should also be given an opportunity to express themselves, so that at the end of the day, whatever service they are going to be given results from the dialogue, the conversation, and appreciation from the person who is receiving the service.
The Executive Director, Infectious Diseases Institute of Makerere University, Dr. Andrew Kambugu, revealed that the Uganda population-based HIV impact assessment gave very dreadful revelations on the spread of HIV.
What the study found is that out of every 5 Ugandans between the ages of 15 and 49 years, only one in 5 Ugandans were not aware of their HIV status. So it means that up to 20% of individuals in that age bracket who are living with HIV do not know that they are carrying the virus. This situation should concern all of us, because these individuals may unknowingly pass on HIV to the people they love.
Kambugu is worried that the permanent solution to the over 40 years HIV/AIDS scourge is not about to be delivered.
My countrymen should not take it for granted that we have ARVs. I remember as a young doctor looking people in the eyes and telling them, you're positive, but there's nothing we can do. So we should not take it for granted that now you can take a pill a day, which keeps you very healthy and looking as those who do not have HIV. But also, I'm a scientist and a researcher, and I know, even as I'm speaking to you now, there are teams all over the world working tirelessly to find an HIV cure and a vaccine. And in fact, there's something called the HIV cure agenda, which is focusing scientific efforts to find an HIV cure. And I can tell you, there's good progress.
UNAIDS Coordinator Monitoring and Evaluation Michael Okot updates on the new trends in the HIV/AIDS care and prevention.
The country still have 52,000 new infections for 2022. That's a yearly figure. And from that, we basically have 46,000 from the adult, that is 15 and above. But how is that 15 and above distributed? 30,000 are from women. 15,000 are from male. What are we doing right for male and what are we doing not right for the female?
Community-led monitoring in Uganda has brought together community organizations in order to improve accountability and accessibility of HIV and TB service delivery. Lessons learned presented by Beatrice Ajonye show the journey of communities who have scaled up monitoring.
So we started the program very big and ambitious. We were in 180 districts and around 400 32 health facilities. Now, some challenges came along, and of course, with the technical assistance from UNAIDS and PEPFAR, to balance between success and the economies of scale, we had to scale down. So currently, as I speak, we are in 80 districts.
Communities affected by HIV have been providing feedback on the quality of health service provision since the early days of the HIV epidemic. Gathering, collate and using this information, however, has not necessarily been systematic.
We have all been to health facilities in outpatient. We know the standard time given to someone going through the outpatient. The client comes in. After 3 minutes, you will hear mamas outside. Is the environment conducive for effective counseling?
Sometimes our patients are just stubborn. Sometimes they just try to appear, who is this asking? Is there anything that might come with it? Can I show more vulnerability? Maybe I'm going to earn something.
Global support is growing for communities of people living with and affected by HIV to collect and use their data to improve their health and broader societal situations, and to hold decision makers and service providers accountable for reaching their HIV commitments. Jethro Kasaiji, Douglas Setumba, UBC News.
Let's come on out, let's come together and fight.